NASH 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. Today, on the occasion of World Liver Day, we have a renowned gastroenterologist from Mumbai, Dr. Priyesh Patel. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Patel is a leading gastro in Mumbai, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with uh, multiple treatments of gastrointestinal and liver conditions. So, sir, we salute your dedication to spread awareness related to liver health. So now I invite Dr. Patel to enlighten us on the topic.
Thank you so much, Mr. Bardwaj, for the kind introduction. So, without much ado, I think we start with the topic. I like to keep it very short and some take-home messages. What is to be done about what is exactly fatty liver, which is a common term generated for a fatty liver or a non-alcoholic fatty liver disease. And then, when the disease progresses, then we have terms like NASH, what is non-alcoholic steatohepatitis. The non-alcoholic fatty liver disease (NAFLD) is a name suggestive in itself. It's a without any alcohol, the involvement of the liver causing in various stages and causing the trouble to the liver, and how we can diagnose and how we can prevent the same. So, liver, as we all know, is the second largest organ of the human body, and it is has so many functions like processes of nutrients, regulators of blood composition, production of the bile, production of proteins and cholesterol. Most importantly, whatever we eat, the protein is disseminated, and the production of the protein happens to be inside the liver. Breakdowns, breakdown of alcohol and medications. I got meeting is being recorded. So, am I audible?
Yes, sir. Yes, sir.
Yeah, sorry. I got some mess. Sorry. So the many functions of the liver, right from breakdown of alcohol and whatever medications, irrespective whether the allopathy or homeopathy or Ayurveda, whatever goes inside the body, the breaking down of the complex material into small things and then spreading it to the body is a function of the liver. And in non-alcoholic fatty liver disease, the fat percentage of the liver exceeds more than 5%. So normally, if it is less than 5%, we are happy. But anybody who has more than 5% fat accumulation inside the liver, in that case, it is labeled as a fatty liver disease or a non-alcoholic fatty liver disease. So, what is the prevalence of NAFLD? 1 in 4 people will have NAFLD regardless of the weight. But if you are overweight and if you are diabetic, then more than 6 diabetics and more than 9 out of 10 with obesity will have presence of non-alcoholic liver disease. So, as we all understood that, according to that, overweight and diabetes are the most important aspects where a person in question will have liver involvement. And in that case, the male gender has been regarded as a higher risk factor. So if you're a male individual, overweight and diabetic, the chance of having a liver disease, irrespective of the fact that you don't drink any alcohol, is very high. It does not mean that it does not happen in thinly built individuals, but the chances of happening that are comparatively lesser in a thinly built individual. And what are the progression of an NFLD? The classic diagram basically easily available all across the net. So if you see the healthy liver, if there is a initial fat accumulation of the liver, you see that the color of the liver has changed and the surface also has become much more smoother. This is the fat accumulation of the liver, the first stage, the fatty liver. Once it progresses, the fat keeps on accumulating there and the liver keeps on getting damaged. Then we come to a stage of liver fibrosis, where fibrosis is basically scar tissue. And you see the scar tissue is in patches. But if here also if there are no corrective measures, then the final stage of cirrhosis of liver or chronic liver disease. You see the difference between the cirrhosis liver and the normal liver. The normal liver is a smooth surface, and the cirrhotic is all become a rough and any fibrotic and a scarred surface. The good thing is that even if you are into a fatty liver stage, there is a reversal arrow. And even if there is some sort of a fibrosis, not completely cirrhosis, even if there's some sort of a fibrosis, there is a reversal and you can go back to a healthy liver. But unfortunately, if you wake up very late, if you come to a stage of cirrhosis, then we don't have any reversal of the liver disease. So what is the difference between the two terminology that I've been using very commonly? One is NAFL and one is NASH. NAFL, or it is only fat accumulation to the liver. The fat accumulates into the liver is known as steatosis. In steatosis, the steatosis will lead to inflammation of the hepatic cells, and this is known as NASH. So, unless and until only the fat is accumulated, that is the first stage. I go to the previous slide. Unless and until only the fat is accumulated, but the liver enzymes are normal, the liver functioning is normal, it is called as non-alcoholic fatty liver. But the moment there is development of a fibrosis and the moment there is a derangement of the liver function test, then we call it as a non-alcoholic steatohepatitis. Causes of NFLD, obesity is the most important culprit. Some people definitely have a genetic background. That is why lean people also will have to have it. Metabolic syndrome includes more than one of diabetes, hypertension, hypothyroid, cholesterol, obesity, and apart from that, physical inactivity. Most importantly, now in this current era, where everything is available on Instamart and Zomato and Swiggy, I assume, and food intake, because our consumption is definitely exceeded our expenditure. Our activity in day-to-day activities has become so less, but our food consumption has become so high that obesity or even fat accumulation is becoming very, very, very common, not only in adults but also in small children, younger children. So obesity, as you rightly mentioned, overweight or obese causes fat accumulation to the liver. The obesity increases the amount of fat from 5 to 10%, and this in turn causes NASH and scarring of the liver. So, threefold increase in of death due to cirrhosis. The increases risk of NASH from diabetes to NAFLD. It is a high risk in diabetes, a 2 to 4 risk in diabetic patients. What are the symptoms of non-alcoholic steatohepatitis? The symptoms usually develop when there is cirrhosis stages come. So when you have a fatty liver disease, when you have a NASH, usually there are no significant symptoms. Some people will come with mild fatigue, but it is very difficult to attribute the fatigue because of the liver, because there are so many causes for the fatigue. Similarly, discomfort or pain in the upper right quadrant, which will be transient because the size of the liver may expand. In that cases, the fatigue may develop, and that cases, the symptoms may come. But otherwise, the symptoms come very late when there is cirrhosis is almost set up. So in that case, there is increased fatigue and nausea, fluid in the stomach or fluid in the feet, confusion, decrease or loss of appetite, bleeding easily. There is unexplained weight loss in some people, yellowish discoloration of the eyes and skin, and some people will have vomiting with blood or dark colored stools. So most commonly, we have to identify the person early in context, not before the person, not after the person develops cirrhosis. So there are a plethora of tests available to find out which stage we are into. The most common test is the blood test. There is a component in the blood test called the liver function test. And liver function test, if you know, has bilirubin, SGT, SGPT, alkaline phosphatase, and GGT. So after SGPT or ALT is the most common predictor of a disease progression. If the ALT is predominantly high, then up to 80% of patients with high ALT will have a normal ALT. But if the ALT is persistently high, then NFLD has to be the first differential diagnosis. Then there are certain scoring scores like FIB4 and NAFLD score, which the doctor will evaluate accordingly depending on the stage you are into. The most common method is ultrasound. You have so many times the person in question must have visited a doctor or a sonographist for an ultrasonography for a pain in the abdomen. And the cause of pain in abdomen would not have been found out, but there would be fatty liver on the ultrasound. So ultrasound is the most common and easily available tool for diagnosis of fatty liver. Then we have certain specialized devices like the fibroscan or transient elastography. So the benefit of fibroscan, it is just like an ultrasound, no non-invasive test, non-painful, and there is no risk involved, no radiation risk also, can be done in pregnant females also, can be done in small children also. So the benefit is that it actually differentiates between a fibrotic liver and a cirrhotic liver. The ultrasound has certain limitations. It can differentiate between fatty liver and a cirrhotic liver, but it does not tell you the stage of fatty liver or the stage of fibrosis that you went. The good thing about transient elastography of fibroscan is that it not only tells you that which stage of fibrosis you belong to, 1, 2, 3, or advanced stages. Also, it tells you a rough idea, okay, what is the percentage of fat into the liver. So there is a goal-based therapy. So you know that anything more than 5, you are supposed to lose weight and you are supposed to evaluate. So fibroscan will exactly tell you that the fat percentage is between 5 to 11%, 11 to 22%, or 22% and above. So we know that whenever our treatment starts, whenever we repeat a fibroscan, we will be happy to know whether the fat percentage has come down, and that will also guide us in monitoring the therapy. The other test which is equally effective or probably more is a gold standard to detect fat is the MRI. So MRI elastography is the gold standard, not very widely available, but in cities it is very easily available. I am practicing in Thane, but it is available somewhere in Borivali if I am not wrong, and somewhere in South Bombay. It is not available so far in Thane. So in two-tier cities it may not be easily available, but if it is available, it is definitely the gold standard because it can measure fat content for greater than 1% also. It is that accurate, and it is if it is not available, the fibroscan is still a better tool for evaluation than compared to ultrasound. Liver biopsy in rare cases we do when there is a differential diagnosis whether the person has NASH or there is any underlying liver disease which has different from non-alcoholic hepatitis and presenting in the same scenario, but we don't do it very commonly. It is only in a rarer scenario. So if we come to a progression stage from the liver disease, once there is isolated fatty liver, there is very minimal progression to fibrosis or with increase in the risk population like diabetes and obesity. Then we lead to NAFLD or fatty liver with mild inflammation. Those patients will go for NASH. From NASH, about 11% over 15 years will go for cirrhosis. And from cirrhosis, about 7% will go for tumor in the liver, that is HCC. And about 45% will, over the next 7 to 10 years, will go for progression of the liver disease, which will lead to a liver transplantation. So our goal is to isolate person here itself and then have a reversal and go back, and rather than go in the future for any advanced therapies and diseases in the liver disease. So, what is the treatment form of NASH? So, this is the most common question asked, and the simplest answer is diet, exercise, and lifestyle modification. The person comes to you in a OPD and assumes that you will give him some wonder medicine, and is so disappointed to know that there is no significant medication here. The medications come very late, but the main treatment with or without the medications remain diet and exercise and lifestyle modification. So, if you are not losing, if you are obese, you have to lose weight. If you are diabetic, you have to control the diabetes. You have to stop the alcohol, no over-the-counter medications, lead a healthy lifestyle. And when you do this, not many will require certain medications. But if you do not do this, definitely you will require medications. And there is no stoppage. The medications will keep on increasing, and you will still have a liver disease. So, diet, exercise, and lifestyle modification is the most important treatment. Combination of a hypocaloric diet provides with exercise provides the best likelihood for weight loss. A weight loss of about 3 to 5% of body weight helps in improving the steatosis. And if you lose 10% of body weight, then histopathological features of NASH, including fibrosis, would be reversed. So this is a very good chart. So if you have weight loss about 3%, the steatosis comes down. If you have weight loss of 5%, the inflammation, that is the cellular level changes which has happened into the liver, the microscopic level changes start improving. When you have weight loss of about 7%, the non-alcoholic steatohepatitis starts to resolve. And if you have a weight loss of greater than 10%, the fibrosis also gets resolved in about 45% of patients. So even if you have advanced disease of fibrosis, though we say it is non-reversible, but if you lose weight and if the weight is the only culprit, even almost less than a few half patient will definitely have a reversal. And at least if it is not reversible, there will definitely be a control where not much of medication and the progression will not be there. So it is not only that reversal, we are also looking at halting the progression, and then we are looking at reversal. But halting is also a very good stage to be in. So diet for healthy food. So most commonly we advise a person in question to have a physical activity of daily, and then probably have 7 to 8 glasses of water. And then obviously we can have the fat rich food only less, very often, very less often. And more commonly something which vegetables and whole wheat and beans and legumes on a daily routine. Aerobic exercise reduces the liver fat, maintains the healthy weight, and improves the cardiovascular conditioning. But along with that, We also advise only if some people tell us that doctor, I walk for so and so kilometers, or I only do jog for so I do only cardio. So my advice to them is that it is very good. It is very good as compared to doing nothing. But and even yoga is very good as compared to doing nothing. But if you do only aerobic exercises, the benefit is limited. If you have a combination of aerobic exercises with resistant exercises like simple weight training, you don't have to become a bodybuilder overnight, but simple weight training, whatever for the muscle mass activity, that works wonders in reducing the liver inflammation, in decreasing the insulin sensitivity, a better diabetes control, and a better weight control. So, if you are not doing anything, please start with doing exercises like the aerobic exercise. But if you're already doing something, make sure that you don't only focus on one exercise pattern all throughout the week, but have a combination. Say 4 days a week you do cardio exercise, but 2 days at least you dedicate for resistance exercises, so that you are having a very well control, and you don't have to go for any fad thing like keto or so-called intermittent fasting and so many things from your. Most commonly, as I mentioned, lifestyle exercise is very, all the doctors preach the same. How many people follow is a difficult question, but yes, it is the same. Here I'll go to the next slide. Yeah, just a single slide about what are the drugs which are available in the market. So there are three drugs which are available in the market for non-alcoholic diabetes, have to be taken only after consultation with your doctor. It cannot be self-medication. The most common and the most available, easily available was vitamin E. It can be prescribed for about 2 years. But apart from that, there are two other drugs which are very good. One is saroglitazole. The brand name is Bilipsa, and the year it helps you with NASH and reducing in the fibrosis also. And after that, we have pioglitazone, but again, it is in both diabetic and non-diabetic patients. The minimum duration suggested is 1 year, but I don't think that you have to take the medicines without the prescription of the doctor. So whatever medication, whether it is vitamin E or whether it is salbutamol or whether it is pioglitazone, it has to be taken only after consultation with the doctor. And tips to prevent the liver disease: limit the intake of saturated fats and trans fat, eat a balanced diet, limit consumption of refined carbohydrates, maintain a healthy weight, quit smoking, exercise regularly, avoid alcohol and medications whichever you take, whether whatever pathy you believe into, you have to have a proper doctor prescribing those medications. It cannot be over the WhatsApp University or Facebook or Insta or whatever that you have read somebody and you have taken bought that medicine and you take it. This usually happens with the new age bodybuilders. They go to a gym or you go to a bodybuilder, and then what happens is that they start taking medications by prescription from somebody who is not even qualified to give the medications. So that is to be taken care of. And that is the end of the topic from here. Thank you. You've been very patient audience.
Thank you so much, sir, for this wonderful and enlightening talk. So now, with your permission, can I take some questions from the audience?
Yeah, sure.
Uh, so, sir, we have a question that how much weight loss is required for NASH and
So,
NAFLD?
so as I always say, so if you are not losing your weight at all, then some weight loss is always better than nothing. But in that case, the most important aspect is कि if you lose at least 3% body weight, then there will be some sort of a benefits which will be seen. The ideal weight loss is up to 10%. If you can lose 10% of the body weight, almost more than 45 to 60% patients will show a reversal, and the progression of fatty liver disease will be going down. So if you let us assume that you are 100 kg, but even if you come to about say if you lose 10% body weight, then you will come to 90 kg. You will see a definite improvement in your liver parameters, in your diabetic parameters, in your cholesterol parameters, and your energy and your levels of activity and everything. So ideal weight loss has to be 10%. That is easier said than done, but it is not that it cannot be never be done. You have to try. The goal has to be at least 10% weight loss.
Right. Thank you so much, sir, for this wonderful insight. The next question is when to visit a doctor.
So ideally, what I would suggest that you should at least have an annual health checkup. And even the see once in a year visiting a family physician, even if you are better, it is still a good good idea, because he will check your blood pressure, you will have your blood tested for sugar, cholesterol, your liver function test, your kidney function test, your thyroid. So anybody who is more than 30, I would recommend to visit a family physician at least once in a year, even if you're all right. One, you don't wait for symptoms. If you wait for symptoms, obviously the treatment is prolonged, and then the reversal is very very far off. So the stitch in time will always save nine. So first thing is the basic annual checkup. If in that checkup your physician feels that there is some sort of a liver abnormality, or the sonography suggests you a fatty liver, then we go for further testing in the form of fibroscan or transient elastography, and look for other causes. And then the guidelines and the weight reduction techniques and stuff start. And in that case, if you require treatment, then the doctor in question will give you medication for this. So ideal thing is to always visit when it is not required, and to have it when you don't need, and rather than don't have it when you need it, kind of a stuff. But then obviously once in a year annual checkup is the most important aspect.
Thank you so much, sir. So now, on behalf of NASH 24/7, I thank Dr. Priyesh Patel for this
Thank you so much.
lively and informative talk. As you have been emphasizing the awareness for liver health and disease, it is equally important for people affected by fatty liver to regularly visit doctors and continue medication. With careful observation and precautions, it is possible to obtain control on the disease. I would like to thank our audience also for their active participation and patience in making this event successful. So stay connected with Nash 24/7 on Facebook and take care of yourself and your family members. Thank you. Thank you, sir.
Thank